Okay, so the primary use of a stainless steel crown is to hold the space, usually in a primary dentition, if the tooth has so much decay and a lot of tooth structure has been reduced. A stainless steel crown will be put onto the tooth structure that is left to maintain the space until the tooth falls out. So what we have here is stainless steel crowns are a metal material. So what we want to do is you're going to look at your patient's mouth and you are going to look at, if you don't know your anatomy very well, you're going to look at the tooth that's maybe across or adjacent to it on the other side. And then you're going to find you need the interproximal area as well as the correct tooth for the anatomy. So we've got several little options here. If we are going to be looking at tooth J on the maxillary left of this primary dentition, we're going to look at maybe on tooth A to see what that anatomy looks like. And then I can start trying them in. And once I try them in, even though the patient's got saliva and it will be contaminated, you can also autoclave them to sterilize them. Okay, so I'm going to look at this tooth right here, and I'm also going to look at, well, maybe this one right here. Okay. All right. So again, we want to make sure that the interproximal area has a contact, just like your provisionals that you're working on right now. So I'm just going to try this in. Actually, I'm going to try this one. So yeah, it may look like it fits. Looks like over here, but actually the width is pretty good. I'm going to try in another one just to make sure that we possibly have the correct width. And this one we have the correct width, but does that anatomy look correct? No, this looks more like a mandibular tooth. Okay, if the tooth, so I'm going to choose this one here. If the tooth is not in the correct, see how the patient now has an open bite? We need to reduce the actual crown down. In our situation here, we are not going to be doing that. If that had to be done in an office, you would first use maybe some crown and bridge scissors to reduce the gingival margin, and then we would crimp it to smooth it out and make it form back to the margins. These are just here for an example. What we're basically going to do is, by looking at the anatomy and the width, we're going to be able to choose which teeth go into the correct position. As you can look here, we have several options, and we have 4 teeth that we're going to be choosing our stainless steel crowns. So it is up to you to choose the correct one. And then this would be cemented on for the duration of this tooth before it falls out with probably zinc oxide eugenol or any other cement that would be soothing to the tooth. Okay, there we go.